My name is Sarah Turl. I am a 7-year cancer patient of the Trust, and I received outstanding care and still do. And I am very, very proud to say that I am a patient partner with the Trust, which means that I work together with the staff of the Trust on improving patient and staff experience.
The Pride Way is our version of the Virginia Mason production system, so it's an improvement methodology, which is a set of tools to drive improvement, but it's also an improvement culture.
What we're trying to do is to improve experience.
We were looking for processes in the hospital that we knew could be improved, that were meaningful to a group of vulnerable patients, but that would also bring in elements of both radiology and pathology. And cancer is a really great example of a process that is definitely dependent on both. The thing about the RPIW is it takes frontline staff. So no longer is it improvement gurus who sit behind coded doors and wander out and tell people what to do.
Clerical staff, receptionists, we have nurses, we have IT people if it necessitates it. Of course we have doctors as well, and of course we have patient partners involved.
We looked at what areas of the booking process were causing the biggest delay, and then from there we generated different ideas as to how to then go about improving.
We use a principle called 5S, which is about maintaining a safe and efficient working environment, having the things that you need where you need them, when you need them, mistake-proofing some of the day-to-day tasks that we do.
Previously, the actual booking process was taking around 142 hours, which for the seriousness of these kinds of procedures, for the nature of the conditions, and also for the patient who has to wait to have these done, that is not acceptable.
Fast, accurate diagnosis is absolutely key, and that is what we have been doing.
So we've seen massive reductions in the time that it takes from a patient to request a guided biopsy appointment to actually getting that appointment. So from, I think, over 142 hours down to less than 24 hours.
We're using visual controls along with our trolleys, so all our consumables are ready for us to use straight away. So again, we're cutting down time on setting up tables, setting up benches.
For potential cancer samples coming into the department, the pre-work time was 21 hours, 19 minutes. And as a result of the RPIW and the work that we undertook, that came down to 5 hours, 20 minutes.
In pathology, we've seen the defects in the samples reduced from 11.6% to 0. And a lot of that is about the things that we've talked about, co-locating the teams, improving the communication.
So the culture change has been immense in terms of suddenly you're seeing people who are very resistant to try new things. They say, oh, we tried this before, it didn't work, or this will not work. So suddenly they are really enthusiastic about further problems down in their service.
It's the cultural element that makes this work. This is what sets it apart.
There is no better feeling than knowing that you are making a difference. And I can't speak more highly enough about it. It has been an amazing experience for me. Bring on the next RPIW.
But it's not just the tools, it's the management structure around that, it's the culture, the empowerment, the training of your staff. Improvement isn't done by 3 or 4 people, and if you can galvanise a workforce and make it part of their day-to-day job, this has got a much higher chance of being successful.